Aspergillosis. Aspergillus most commonly enter the human body via inhalation. Most people breathe in Aspergillus spores every day with no ill effect. However, in patients with pre-existing medical conditions, Aspergillus can start to proliferate and cause disease, primarily a lung infection. Infection is more likely if a large number of spores are inhaled, such as on exposure to very dusty environment or during innovation of a building. On rare occasions, the fungus may enter via the skin. Primary cutaneous aspergillosis, particularly in patients with thermal burn or trauma of biomedical equipment. Contaminated is due to contaminated biomedical equipment. There is a burn in the skin, there is trauma, or contaminated biomedical equipment. There are 4 common clinical patterns of disease: acute invasive aspergillosis, allergic aspergillosis, aspergilloma, chronic necrotizing pulmonary aspergillosis. Acute invasive aspergillosis. Acute invasive aspergillus has a rapid onset and the disease progresses quickly. The fungus invade and damage body tissue, most commonly the lung and or sinuses, but can spread throughout the body via the bloodstream. Symptoms include fever, cough, breathlessness, chest pain, facial swelling, bleeding nose, blooding of an eye, neurological symptoms. Other symptoms develop if the infection spread beyond the lung and the sinuses. There is a high fatality rate. Who have had a bone marrow transplant. Patient can be infected with aspergillosis. Patient who have had a bone marrow transplant, solid organ transplant, or in high dose of corticosteroid. Immunocompromised patients. Chemotherapy for cancer such as leukemia with advanced HIV infection. Those patients are immunocompromised, immunocompetent. They have transplant, have corticosteroid, long course of corticosteroid, chemotherapy, or HIV infection. The immune system is compromised. Allergic aspergillosis. Allergic aspergillosis is an allergic reaction to the aspergillus fungus in the lung and or in the sinus. Lung symptoms include fever, wheezing, and coughing. Patient may cough up blood or mucus plugs. Sinus symptoms include facial pressure, headache, blocked nose, yellow or green discharge from the nose, and the cough. Allergic aspergillosis can affect anyone, but is more common in people with asthma or cystic fibrosis. Aspergilloma. Aspergilloma is a fungus spore that develop in the pre-existing lung cavity. It may cause no symptoms, or the patient may cough up blood, which can be perfused and life-threatening. Aspergilloma can be also developed in other organs. Aspergilloma affects people with an underlying cavity causing lung disease, such as tuberculosis, emphysema, cystic fibrosis. Chronic necrotizing pulmonary aspergillosis. Chronic necrotizing pulmonary aspergillosis is a rare condition that causes tissue death within the lung. This form aspergillosis slowly progresses over weeks or months. Symptoms often include fever, cough, night sweats, weight loss. Chronic necrotizing pulmonary aspergillosis usually affect people with mild immune impairment, such as underlying lung diseases, alcoholism, or who are on long-term corticosteroid therapy. Around 5 to 10% of patients with invasive aspergillosis develop skin lesions. Lesions include single or multiple red, violet, hardened plaque or papules, plaques or papules. The lesion may be tender or symptom-free. As the lesions evolve, pus or blood-filled blister develop in center, which eventually become necrotic, blocking ulcers or scabs. Lesions most commonly appear on the limbs and head and may affect small or large areas. Aspergillosis diagnosed by Sample of sputum, blood, affected tissue can be cultured in the laboratory to grow aspergillus. The fungus may be visible under a microscope in biopsies of the affected tissue. Special stain of lung fungus may be needed, but other fungi may appear near identical chest ray, or CT scan of the lung can reveal characteristic abnormalities. A newer antigen-based test is available to detect evidence of invasive aspergillosis in blood. However, the accuracy of this test appears to be variable. Here, the X-ray, chest X-ray, appear the aspergillosis. Here, the aspergillus stains. This is some cultures of aspergillus, and this is its appearance under microscope. This is fungus, the aspergillus flavus, aspergillus. Here also the lung, picture of the lung appear, the fungus. Here potassium hydroxide of the culture smears. Here aspergillus basic acid chef stain, the aspergillus appear. Here the Gens stain, also this is the hyphae of the aspergillus appear clear. Aspergillosis treatment: Variconazole is currently used as first line treatment for invasive aspergillosis. Other drugs used to treat aspergillosis include itraconazole, amphotericin B, casbufangine, mycofangine, fosconazole. Prolonged treatment is usually required when possible. Immunosuppressive therapy such as systemic corticosteroid should be discontinued. Surgical removal of the infected lung cavity may be required in cases of an aspergilloma. For prevention of occurrence of the aspergillosis, avoid dusty environment, construction sites, gardening, and low mowing. Wear protective face mask when near dust environment. Take preventive antifungal medication if recommended by your physician. Use a high efficiency particulate air filter, HEPA filter in the hospital to prevent